So, Murray and Clark define aphasia as a disruption in using and understanding language following neurological injury or disease that is not related to general intellectual decline or sensory motor deficits. So, one part of a definition is clearly what a condition is not. And so, here we're saying that the problem is not to general intellectual decline like we see in Alzheimer's disease and dementia. We're saying it's not due to sensory deficits, so the fact that a person isn't able to speak is not because they're deaf or or they have motor deficits. So, for example, a dysarthria or even an apraxia of speech. And then the authors go on to say any language modality may be affected. And they go through those language modalities. The main point I'd like to make is that I think many definitions, many authors conceive of aphasia as, by its very nature, multimodality, language impairment. In other words, people with aphasia, even mild aphasia, if we test them sensitively enough, they will show some weakness compared to their premorbid status in every domain of language: speaking, understanding speech, reading, and writing. And so, for example, for auditory comprehension, sometimes it can be somewhat difficult to detect mild problems with auditory comprehension. Typically that shows up when we ask people to comprehend sentences with very complex syntax. If we start making our judgments based on, let's say, story length material or even paragraph length material, then sometimes poor comprehension may be due more to attention issues or some other cognitive issues. Aphasia is not congenital. In other words, of course, there are children born who never develop or develop language poorly. We don't classify that as aphasia. Aphasia is an acquired problem, most often acquired by stroke. However, one can get aphasia if you have a head injury and part of that injury involves damage to those specific areas of the left hemisphere that are responsible for language processing. I believe, which case is it? Patient 4 on your DVD, an example here, individual with aphasia from TBI. If you look at the history that is provided in your DVD on this patient, you'll see that he had hematomas. Hematomas, remember, are kind of blood blisters between the skull and the dura, or between the dura and the brain. They can place pressure on areas of the brain underneath, causing some damage. And he had left parietal and temporal hematomas. So the inferior parietal lobe, superior temporal lobe are involved in language processing. But stroke is certainly the most common cause.